All right, so the test we are now going to be performing is the position and the mobility of the patient's first ray. So I'm going to have him lying prone in the figure 4 position with one of his ankles crossed over the back of his opposite knee. Now to do this first, I have to find a couple of different landmarks and put my patient into normal position. Normally I would have this table a little bit higher, but because it's a little bit lower, I may have to make some adjustments in my position. So what I'm going to do here is I'm going to find both sides of the talar neck, and I'm going to go ahead and wiggle the patient's foot around until I feel even pressure with both sides. Then I'm going to slightly dorsiflex the patient and go ahead and note where I see the line of his distal tib fib and his calcaneus. And I'm going to use this line when I go ahead and assess the position of the first ray. So when I'm here, I'm going to go ahead and grab either side of the patient's first ray, and what I should see is that if I put a pen around the patient's on the plantar surface of the patient's forefoot and my line, my calcaneus, these should be parallel. If I were to have my marker lined up vertically on that calcaneus, it should be perpendicular to that line of my forefoot. If the patient's marker is moving closer to the inside, that would be indicative of a pronated foot. And if I saw my marker laterally move, then that would be indicative of increased supination of the foot. So from here, I'm going to go ahead and sit down so that I can have a better position for chase. I'll use one hand to support my lateral 4 met heads, and I'm going to use my other one to just go ahead and grab Chase's met head of his first metatarsal. I'm going to move Chase both plantarly and dorsally into checking the mobility of this first ray. So what I should find, normal findings would include no more than a finger width in either direction and about equal in both directions. So I should see equal movement of this met head as I move dorsally and as I move plantarly. I'm going to go ahead and compare this to the other side. All right, so the same position here, I'm going to go ahead and find the neck of the talus and wiggle the foot around until I feel it evenly in my hands. I'm going to have the patient slightly dorsiflexed. I'm going to go ahead and mark the position of the distal tib fib and that calcaneus. From here, I'm going to come underneath, and I'm going to note the position of the calcaneus to the forefoot. And I can look at this either parallel or perpendicular. And the last thing I'm going to do to assess this mobility is go ahead and grab the 4 met heads, and then grab the patient's met head on that first metatarsal and go ahead and move it dorsally and plantarly. And again, positive findings could indicate a significant difference in both sides or more than a finger width, which could give us a little bit more into that first ray's mobility for this joint play test.